Hello and welcome everyone to RelTalks. So RelTalks is a series put on by Relevate. Relevate is a multidisciplinary team of researchers and people in communications and people in tech development who are interested in spreading the knowledge of relationship science to the public. RelTalks is a subset of Relevate where we give the opportunity for up and coming researchers to provide their research about relationships. And our up and coming researcher today is Derek Morgan. So Derek Morgan is a second-year doctoral student at Texas Tech University in the Human Development of Family Studies program. He received an MA in Family Science and Human Development from Montclair State University in 2018. And has been engaged in community mental health ever since. His research investigates family functioning, including parent, child, and sibling relationships, and its association with mental health. Derek's professional goals include working as a professor at a research university and teaching students about human development. Derek enjoys spending time outdoors, doing home improvement projects, and hanging out with friends and family. So Derek, thank you for joining us. And I will turn it over to you, and you can go ahead and start. For those of you who are in the audience, if you have any questions at any point during the presentation, keep yourself muted and just go ahead and type your questions into the chat function at the bottom, and we will ask Derek at the very end. So Derek, without further ado, go for it.
All right. So as he said, my name is Derek Morgan. I'm going to be talking a little bit about parental mental health and COVID-19 and more about just what we've seen and more about those experiences and what's happened so far for families. All right. My computer makes noises. Okay, there we go. So what we're going to cover over this presentation, we're going to review the effects that COVID-19 has had on parents and families especially. We're going to define what we mean when we're talking about mental health, specifically to depression and anxiety. We want to address the positive aspects of coping and how coping can really be beneficial for families. And then we also want to provide some guidance for parents moving forward. Seeing from what's happened from COVID, some of those effects on families, we really want to stress that importance for parents. All right, so it all started when COVID hit. So early 2020, around March, is when the coronavirus or COVID-19 first landed and started hitting out throughout the US and across the world. We started to see a lot of different impacts from this, especially from governments and local agencies trying to cut down on lockdowns and having people outside for possible exposure, limiting that. But there was also a lot of misinformation and just information constantly developing. We really didn't know a lot about COVID at the time. So governments and different agencies were trying to develop those as fast as they could to try and get that information out to families. So this was really stressful, especially to parents who have, children or dependents, people that they were taking care of. And they had to manage not only for themselves and those stressors of the news and everything else going on for COVID, but they also had to manage it, for how they're taking care of their families. How are they going to focus on that and make sure that their families are being taken care of, that they're, taking in and understanding everything that's happening around them, but really, how they're processing that information and linking that to families. So with that impact on families, during COVID, with lockdowns especially, we also started to see a lot of issues with unemployment, loss of jobs. People were having trouble being able to make rent. We saw stipends being given out across the world by multiple countries to try and help citizens who were impacted by that, those who couldn't work or those who lost jobs, those non-essential employees, anyone who was deemed in that field. Some of them were stuck at home, so they weren't able to go out and go work and do those things that they were normally doing in order to make an income and support themselves and their families. On top of this, with lockdown, we also saw a lot of school closures. So especially with those who had kids, those kids now weren't going to school during the day. They were now at home. Some of those who still had jobs now had to manage that on top of it. They had to make sure that their kids were continuing to get an education. That put stress on making sure that families have internet access, that they're getting supplies from the school, that their teachers are still being engaged and working with their children, but especially on that parent side, what it is that they were doing for their kids and how they were taking care of those kids and supplementing that education. So for the impact on families, we really saw this negative kind of stress culminating from COVID just affecting families, how they were worrying about COVID, possibly infecting themselves or their kids, who was going to take care of them. But really how they were going to manage all of this new stress, all of these new things that were happening, and especially for themselves, but toward their kids, because that's really where a lot of this focus went. And so with COVID and this impact, we also saw a lot of stuff start to affect mental health, especially. And so when we're talking about mental health, like I said earlier, one of those things we want to talk about is depression. And when we're defining depression, we want to focus on those feelings of being sad, lethargic, apathetic, demoralized, hopeless, just that loss of general interest of activities that you once enjoyed, or maybe were self-loathing, not appreciating yourself as much or giving yourself as much of that self-care as you were really needing. And so to really exemplify this, for this example, we're using Eeyore from Winnie the Pooh. Often throughout any interactions with Eeyore, we're seeing him put down himself or not really take care of himself to the best ability, or to find joy in those other things and activities he's still doing. In this example, we're seeing him say, it's not much of a house, just right for not much of a donkey. So a lot of self put downs, that negative self-talk really directed toward himself, but really losing that sense of care and what it is that was really important in life, or those things they really enjoyed. So that's what we really wanted to focus on when we're talking about depression. So specific to the pandemic and what we started to see, we wanted to focus on these rates of depression. So before COVID, we were seeing clinical rates of depression, those who were diagnosed with that. We would see that in about 1 in every 10 individuals. During COVID, or at least the early stages in 2020 and early 2021, that rate increased to about 1 in 3. So we went from, a 10% chance of someone having COVID to now a 33% chance of seeing that, someone might be diagnosed with clinical depression or having these really negative depression experiences. And so we really wanted to focus on this, especially with families, and trying to understand a little bit more what was going on. On top of depression, we were also focusing on anxiety. And so for anxiety, we want to focus on that feeling of being tense, worried, that loss of control, having a lot more perceived stress happening. And we can kind of exemplify this and see it through Rabbit, also from Winnie the Pooh. Rabbit, kind of kept more of that stress at all times, worry about things that he couldn't control, or things that, typically we may not consider to be significant stressors. And what we're really focusing on when we talk about anxiety is the difference between normative and non-normative stress. So normative stressors, such as taking an exam, that might be something stressful, doing a new activity that you're unprepared for, something that you don't have prior preparation for. Those can be normative stressors, things that happen. Non-normative stressors would be things that might happen throughout your everyday life. That could be, getting up, getting out of bed, making your bed, even brushing your teeth. Those might become new stressors, like just general everyday activities that you're used to can now become extremely stressful for yourself, or things that you're worrying about. And so when we're talking about anxiety, we're really focusing on having that new stress, and that feeling of just being stressed or anxious that carries on throughout the day. So it's not something that's just a one-time feeling, but something that continues to happen. And also during COVID, we also saw rates of this increase. So clinical anxiety, those who would be diagnosed with generalized anxiety disorder, before COVID, we saw it in about 1 in every 20 adults. During COVID, we saw it in about 1 in every 5. So during COVID, we really saw these really significant increases in mental health for depression and anxiety. And what we want to do is focus on some of those positive things. What can we do to help with those negative experiences of mental health? And one thing we can do is talk about coping. So what does coping do for us? Coping provides new opportunities. It's a way to remove oneself from a stressful situation, give oneself time to adapt and better manage that situation and our expectations toward coping, or not toward coping, but toward stress. And we use coping to do these things. There's lots of different activities that we can do with coping. On this slide, we're talking more about working out, reading, cleaning. These are more of those stay-at-home activities, things that families were then having to do because they were stuck at home. How are they managing these new stressful situations, constantly getting new updates about COVID? There's new variants, new strains. How are those things affecting them? And what were they doing to really address themselves? When we talk about coping, what we really want to focus on is how coping can be influential, and what it is that works for you. So, we teach a lot of different coping strategies, especially those of time management, positive thinking, just taking that time to do deep breathing and taking a second. So different activities work for different people. For me, I would say that maybe doing those deep breathing techniques might not work. They might not be my coping style, but for someone else, that is a coping style that works for them. Taking that minute and just, taking a deep breath and just relaxing. Maybe it's taking that time to read a good book. But when we talk about coping, we really want to focus on its different ways to manage stressful situations and stressful experiences and give ourselves time to adapt to what's going on. But it's really all about figuring out what works for yourself. And so through this, what was going on with COVID, all these different experiences, what we were focusing on in our study was on families. So in our study, we interviewed, or we sent surveys to parents. They completed one at the beginning of the fall 2020 school semester and one at the end. We asked them different questions. So we focused on economic pressure. What were those things that they experienced that impacted their ability to pay rent or buy food? Did they have any significant changes in their income? Were there things that were affecting them or changing what it is that they had? And that was one thing that we focused on. The next one for COVID stress, for that, we wanted to know about how they were anticipating COVID affecting their lives. Were they seeing that, maybe they were worried about COVID infecting themselves, a family member, maybe it would affect their job or their income, and just how they were perceiving COVID affecting them. Next, we want to look at approach coping. So those positive coping skills, those things that we do to manage that stress, and the different ways that they did it, but also how engaged were they in those activities? Not just if they did one, but were they actively participating in those activities? Did they use them often? Like, what was the focus on addressing that behavior? And finally, on mental health reports. So we asked questions about depression, about anxiety, to get a clinical idea of what was happening there from their perspectives. So what we found after looking at this is that economic pressure, that ability or feelings of what it is that they're able to manage, what they can, if they're going to have income, if they're not going to be able to afford things, those greater negative economic experiences, that was then predicting their ability to manage and perceive stress from COVID. So those who were having more issues with being able to pay rent, buy food, they were reporting greater stress from COVID. They were reporting it impacting their lives more, and they having more greater worry about it. That then, from COVID stress, led into their mental health. So we saw worsening reports of their depression and their anxiety. So if you have, what we found is those who had worsening economic pressures, so you were having more of those concerns about buying the things that you need for your family. That was leading to stress about the current pandemic and what was going on, which was then impacting mental health. So it was just a cascade event that just generally kept making things steadily worse for these families. So then we looked at coping. We know that there are negative things that affect mental health. There's lots of them, but what about those things that positively buffer mental health and help prevent those negative effects? So we were looking between COVID stress, their ability and their use of approach coping, and then their later mental health. So we didn't see an effect with depression, but what we did see was a very interesting effect for anxiety. So what we saw, and with this blue line, we're going to say that that's the low stress that they were feeling from COVID. That led into their use of their coping skills, how often they use these coping skills, which actually was a lower use, which then resulted in lower anxiety. That red line is that high COVID stress, which also led into high use of coping, and we saw higher anxiety from those families. So what was really important about this, and what's important to conceptualize, is not that coping isn't effective, but that the amount of coping that we're using is indicative of our later stress, what we're experiencing, and even our, later anxiety and what's happening with us. So it's not that COVID or coping isn't effective, but that we get to see how often it's being used as a predictor of how our current levels are. And what's really important is not to dismiss coping, but just to say that there's lots of different ways to use coping, and there's other ways to also address mental health. So for families, and especially for these parents, we want to focus on their kids as well, and how influential mental health is. So parental mental health is extremely influential on their kids. 50% of children who have a parent that has a mental health diagnosis or issue are likely to also experience mental health issues later in life. And this communication that parents have with their kids is really beneficial and influential on these kids' development for mental health. So previously in the past, we saw, roughly 60% of parents weren't talking with their kids about mental health issues. Nowadays, we're seeing that level is only about 13% of parents don't talk about it. But really what we're stressing is that openness, being open about issues that you face, how you're addressing those issues, ways to say, I'm stressed right now. How I'm going to relieve that is I'm going to take time for myself. But demonstrating that and showing it for kids, doing that modeling behavior, that's really helpful to them, because then they know that if they're experiencing something, they've seen you do it and ways that you've managed the stress, but also having more open communications about your mental health or things that might be wrong, feeling a little bit more down or feeling more anxious, and having that open line of communication with the kids. Those who are able to express those are generally able to get more help. And that reduces their instances of negative mental health. We're able to address that right there. So really just being open about what's going on and how we can really help those kids is super important. And finally, we want to talk about how we can access help, how we can really get these things. So coping is extremely influential in mental health. We know it's a great way to regulate and manage stress, but sometimes it's not going to do everything, especially when it comes to depression. Like coping, we don't normally see really significant levels in reducing depression levels. And that might be where you would want to talk with a provider or someone who's a specialist in this. But often, while we might talk more about mental health nowadays and we're more open about it, we don't often talk about how to access help, how we get those providers, how we get, that other person who is a specialist in this and really knows what they're talking about. So one website, the one that I use, is the national website from SAMHSA, or the Substance Abuse and Mental Health Services Association. That link is the national registry. So you can look anywhere across the US, and it'll provide links to any private providers, government providers. And that's also important if you're worried about what you can afford. Maybe you don't have insurance, maybe you do have insurance, but there's different providers for different things. And SAMHSA can be really helpful for finding what it is that you need and linking you with different resources. And so we really want to stress the importance of, if there are issues and you're having mental health issues, of finding someone who can help with that, or finding a provider. And there's different resources. There's government resources, there's state resources, there's local resources. But for all income levels, anyone who might need help, there's all these different resources available. We really want to stress that. So that's the general idea of my talk. I'm finally going to acknowledge our participants, those families that talked to us, that gave us that experiences of parenting during the pandemic, and to my co-investigators, Thomas Higgins, Dr. Paul Ingram, and my advisor, Dr. Christy Rogers, because without them, this talk wouldn't be possible. All right, thank you so much.
All right, thank you, Derek. That was great. So this is the time for questions. So if you have any questions in the audience from watching Derek's talk or hearing him speak about stuff, this is the time for that. So go ahead and use the chat function at the bottom of your screen on Zoom. Just click on that and type in your question. And while you're doing that, I'll pose a question to you, Derek. So one of the things that I always think about or I always hear about from people when I talk about anything mental health related is kind of the difficulty of, almost like getting started. Like, once I know what to do, that's great. I know I can go get help from a therapist, or I know I can use coping skills. But sometimes we have these, barriers that might be in the way. So what kind of barriers, I guess, have you seen, and what are the ways to kind of like overcome those potential barriers?
Right. And it is hard, especially finding any provider or just, getting involved in taking that first step. So when we're finally, starting to recognize in ourselves that we need to, it's important to, maybe start looking online. It's an easy way to just start looking like different types of providers, or even looking up your symptoms, or maybe not symptoms, but your experiences just in Google. I'm having questions about this. There's lots of different resources online of suggestions for the type of providers that people need. But there's also lines across the country, national mental health lines, or any of those that you can just call up and talk to and just ask questions and say, I'm having some questions about this, or maybe I'm thinking I might need some help with this. And they can actually start you as well and provide you some guidance so that you're not committed into anything, but that you can start to ask some questions and they can provide a little bit of guidance without pushing you one way or the other.
Yeah, and I like that you bring that up too, because I feel like sometimes when people think about hotlines, it's like, I only call that when I'm in crisis, or I only can call that when I'm suicidal. But like, just, thinking about, calling one of those resources and just kind of like learning a little bit more, taking a small step, whatever that might look like. And those small steps certainly seem a little more manageable, like looking something up online, or, calling a resource or service like that, as opposed to feeling like, oh my gosh, I have to like do this thing, because that sometimes can feel overwhelming.
Right.
So we have a couple other questions for you. So Paige has a question. Do you have any advice about shaking up coping skills? The pandemic's been going on so long, true story, that I think sometimes my coping skills aren't as effective as they were pre-pandemic. Right.
And this actually goes into lots of other bits of research on coping skills and effectiveness of those that were taught and those that were taught by professionals and those that were self-taught. And having that interaction with professionals, those who, that's what they do, their focus is on mental health, on helping people manage it. There's a lot more effectiveness in those skills versus those that individuals pick up by themselves and have to learn. And so sometimes it's talking with friends and asking them like, hey, like, what are things that you do? Try new activities, try new things. Baking might be something. I know I like to bake. Like, that's a nice coping skill for me. I know other people don't like to do it, but I'm more than happy to do things with them or do different activities just to try out things for myself. If you know that a coping skill is starting to not work, for yourself, it's something that you regularly use and you're not seeing that effectiveness anymore, that's definitely where I'd recommend talking with a professional or finding someone to talk to, trying something new. It's not saying that's necessarily not effective, But, there might be new stressors that are going on. Like you said, COVID has been going on for a long time at this point. We were not anticipating it to go this long. And, what we have, our resources, like our innate resources, those are being tapped out after a while. So we really, forging connections with others, really bridging those gaps. Those are things that are really helpful in addressing coping and management of mental health.
Yeah, it definitely can be hard to try new things sometimes when it comes to coping, especially if you have something that works and then it's like not working as much. That can be definitely like, difficult or cause panic. But trying something new, reaching out to people, I think those are all great. And I'm also glad you brought up baking. I've used the pandemic to really nail down how to make cinnamon rolls. So that's what I've been able to do over the course of the pandemic so far. So a couple questions from Twyla. So first one, if you could talk more about your participants or the families that you talk to. And then I'll ask the second question later. So I'll give you, go ahead and answer that one first.
All right, so the participants that we had, I'm based out of Texas Tech. So we got our participants out of North Lubbock, or not North Lubbock, North Texas. And so, it was kind of a wide region, but we had just under 200 participants. I think we ended at 198, 97 between there. But it was a nice, actually, sample of both moms and dads. We were about even 50-50 for that, which is a little bit different in a lot of research. We typically see moms are typically the ones answering these questions. So to have that influence from dads, it was actually really important for us because it gave us another enhancement on, it's not just, moms reporting this stuff or that connection with their kids or their mental health, but we're also seeing, that dyadic of gender and how that's interplaying for these families. Yeah. Hopefully that answers a little bit more about the participants.
Yeah, and the second question, and I really like this question as well, are you aware of any data about who is leading the charge on disseminating mental health info to parents? So schools, community agencies, employers, I'm sure we can think of others as well, but where are they kind of getting, where can they get this information from, or where are they getting this information from?
So there's a lot of information just being posted online. That's generally where a lot of it comes from. But the issue with that is that a lot of it is not always checked by especially professionals. I am a big advocate of mental health professionals. I've worked in mental health. I still work in mental health, but having professionals check that to make sure that the right information is getting across. Because, like when we're talking about coping skills and those types of things, it's helpful to know what they are, but it's really helpful to have someone who knows about them and really knows about them teach you coping skills and how to effectively use them, when you should be using them. So this information, I don't specifically know who's leading it. We see a lot of local agencies, governments, cities. They're trying to push a lot of information. Generally, people don't always look at that, but they do have a lot of good information that they are pushing. They are linking a lot with research. They're linking with the national services, so SAMHSA, NIMH. They're linking with big national government agencies, and they're trying to get this information out. But sometimes it's not as pretty as some of other information that might be presented. It's a lot of statistics, a lot of numbers, a lot of math, and that's difficult. I know it's difficult looking at it, and it's hard to get across. But I'd say it's definitely coming out. We see it in schools. We see it kind of everywhere. The problem is just making it cohesive and simple enough that it actually makes sense, and it's not just that just so much data and so many numbers and so many statistics that it no longer makes any sense.
Right. All right. So it looks like that's all the questions we have. So Derek, thank you so much for doing this. It's been a pleasure.
Yeah.
Just to kind of for the audience, Twyla says thank you as well. So just a little bit of information for the audience. So we do not have a RelTalk next week, but in 2 weeks we have Stellianos Saropoulos talking about safety. So I look forward to that one as well. I hope everyone has a great night, and we'll see you later.